is a good feeling to have someone say, geez, you made it so I can walk again. You made it so I can swim again. That's pretty rewarding.
Within 2 weeks, I was out and about walking, and people couldn't believe that I just had a hip replaced.
Clearly, we use our joints more for activities like sports and outdoor activities, locomotion early in our lives, and as we start gradually having wear and tear on those joints, we start injuring them to the point that they're not salvageable. And at that point, we start talking about joint replacement type surgeries.
I had my first appointment with Dr. Olscamp and Ryan. They're both very good, put my mind at ease. I was very apprehensive about hip surgery because I frankly had never had any major surgery in my life. Ryan put my mind at ease and explained the whole procedure to me, what they were going to do and how it was going to affect me, and which took about an hour. I was out of surgery and up and walking at 10 p.m. and it was a great experience.
So there are really 4 components to a total hip replacement. One is a stem that goes down inside your femoral canal that holds the ball, which will just a separate component that fits onto the stem. And then on the cup side is a metal-backed cup with a porous surface that your bone grows onto, and a plastic liner between the ball and the metal-backed cup. Putting them in has gone through a number of different changes as well. The principal approach was a posterior approach, and now we've kind of developed a little bit further along. Now we're going in anteriorly, which is similar to the posterior approach, but as it turns out, you can do an anterior approach and not detach muscles, just pull them out of the way. A little bit lower risk for dislocation rate, much faster recovery rate. People get to walking and putting weight on it and using their hip with a fairly normal gait within 2 or 3 weeks often.
I got calls to see how I was doing, seemed to be attentive to me as a person and not, just that I was somebody that, came through and, okay, we're done with you. It wasn't that approach at all.
So I work out of the Northwest Specialty Hospital. It's a privately owned surgical hospital. The single biggest benefit is a low infection rate. And in our facility, it's currently at less than a quarter of the national average. From a patient perspective, that links together, because if you're a patient having a joint replacement, the single most important thing in your mind should be, I don't want to get an infection. In addition to that, more personal environment, all private rooms.
It's good to be pain-free and walking, and when you go through your daily routine and you stop and think for a moment, oh geez, that doesn't hurt, well then you know it's right.
The reward of helping an elderly person be able to resume going on walks with their family members or with their dog, or the ability to help some young athlete get back to playing sports when they ruin their knee and tear their ACL or whatever is pretty outstanding.